May is National Stroke Awareness Month. To answer some questions about stroke, stroke symptoms, and preventing stroke, we're joined by Diane Stephan. Diane is the clinical nurse manager of Cooley Dickinson's emergency department and also our coordinator of Cooley Dickinson's stroke support group. Diane, how can we recognize the symptoms of stroke?
By using the acronym FAST, you can recognize stroke out in the public. As you see the sign behind me, I'll review the acronym. F is for face. If you experience any drooping of your face or your face feels numb. A is for arm. If you notice that your arm feels heavy or not coordinated. S is for speech. If your speech is slurred or it's thick and people are having trouble understanding you. T is for time. If any person is experiencing any of these symptoms, you need to call 911 immediately and do not drive yourself to the emergency department.
For that person who is having a stroke, what can they expect once they get here at Cooley Dickinson Hospital?
So you'll be met by an emergency room doctor and a nurse, and the doctor will ask you several questions and may ask you to do some simple tasks like raising your arms or lifting your leg. Once that assessment is completed, it'll be determined whether you are going to go directly to a room in the emergency room or you'll go to CAT scan. If you go to CAT scan, upon your return to the emergency department, the emergency room doctor will be at your bedside, as well as a Mass General neurologist will also be there on our teleneurology TV screen. They will then decide whether you will require the drug TPA, or otherwise known as a clot-busting medication. Once this is decided, the next decision is to determine whether you will stay at Cooley Dickinson, which is a primary stroke center, or be sent to a comprehensive stroke center. This decision is always made in your best interest.
What happens when someone who's had a stroke goes home?
Once you go home, your journey isn't complete. The journey to stroke recovery can be a very difficult one. And at some point you may feel isolated, depressed, or hopeless. We at Cooley Dickinson do recognize this, which is why we have started a stroke support group. We meet once a month, the fourth Tuesday at 10 a.m. in the Childbirth Center conference room here at Cooley Dickinson Hospital. The stroke survivor, as well as the family member and caregivers are welcome to come to this group. The goal of our stroke support group is to promote an atmosphere of caring, cooperation, as well as encouraging new goals and encouraging independence. For more information on the stroke support group, contact me, Diane Stephan, at 413-582-5039.
Is there anything else you'd like to add today?
I'd like to talk a little bit about stroke prevention. Did you know that 80% of strokes are preventable, and that untreated high blood pressure is the number one cause of stroke and the most preventable? The Stroke Association recommends that you see your doctor regularly for frequent blood pressure checks. You take your medication as directed, you exercise regularly, and eat a healthy diet. For more information on stroke prevention, go to www.strokeassociation.org.
Thanks, Diane.